Hi, I'm Gary Mathews. I'm the radiologist and medical director at Center of Acadiana. Dense tissue refers to what the tissue looks like on the mammogram. So on the mammogram, there's the white tissue and dark tissue. And the dense tissue is the white tissue, and that is the tissue that's composed of the fibrous and glandular tissue, and the dark tissue on the mammogram is the fatty tissue. So women that have more of a proportion of the fibrous and glandular tissue are more dense than women that have more of a proportion of the fatty tissue. And it doesn't take much of a variation to look different on the mammogram, but when it is more dense, it just looks more white. So the more white it is on the mammogram, the harder it is to see white spots, which is what we're looking for when we're looking for cancer. So the dense tissue is white, and so is a cancer when it shows up as a white spot. It's important to know that because it matters how easy it is to find cancer on your mammogram. For women that have less dense tissue or more fatty tissue, it's very easy to see white spots. But if you have more dense tissue, it's harder to see white spots. So smaller cancers may go undetected as it may be obscured by that white dense tissue the way it looks on the mammogram. The dense tissue issue has become so important that some states have passed laws about it. And these laws require radiologists to notify women of their density so that so they can make an informed decision about whether or not to have other tests that may help with the mammogram. Louisiana has not passed a law yet. There's been 22 states that have passed laws, but Louisiana has not done that yet. There is a bill that was recently introduced into the current session of the Louisiana legislature that will require radiologists to notify women of their dense tissue and to notify that there are alternatives. But so far it's passed the House of Representatives, but it's gone to the Senate and is in committee for discussion and debate. I decided that when Texas passed their law in 2011, that we would go ahead and start notifying women of their breast tissue density because we thought it was important to do that. Research shows that when we add another test to mammography, such as ultrasound, we can actually do better in finding breast cancers that wouldn't have shown up on the mammogram alone. So we've taken action to, number one, notify women in their letters with the results of their mammogram that they do have dense tissue, and we are offering breast ultrasound as a screening tool to go along with the mammogram for women with dense tissue. And we have found, after doing this for almost 2 years, that we are finding more cancers that would not have shown on the mammogram alone. So it is successful.